When it comes to the prevention of cystitis and urethritis, will depend mostly on the causes. Women should drink cranberry juice to encourage acidity of urine. Why? When urine is acidic, it will interfere with bacterial growth. Welcome back to this channel where we talk about the basic medical information making a difference. Those ones who have just come across this channel for the first time, consider to subscribe because subscription is free. The returning subscribers, thank you so much for always coming back to check on this channel. I go by the name Rebecca Morangi, and this is the best place to be. Kindly watch the video till the end. Today's video will mark the end of the discussion on the first urinary tract problem, which was discomfort during urination, in other words, cystitis and urethritis. And we are going to look at the prevention measures and the complication. Some people shy when it comes to this part of the urinary tract, and your doctor is used to talking about them each and every day so that you get the best treatment. When it comes to the prevention of cystitis and urethritis, will depend mostly on the causes. One of the major causes is the cause of bacteria. We have allergy. Some people react to certain toiletries, friction or bruising of the urethra during sexual intercourse, not forgetting sexually transmitted diseases like chlamydia, gonorrhea, even genital herpes. So when we talk of the prevention, remember, cystitis mostly affects ladies. The causes will help us get to know the prevention. Whatever we are going to go through will help to minimize the chance of recurrence. These are self-help measures. One thing to note is to practice good hygiene. And here I mentioned of the anatomy of women where the urethra is shorter, like 1 inch, and the urethra for men is longer, like 10 inches, which makes women to be more susceptible to this condition. Now, how can you practice good hygiene to prevent this? Always remember to wipe yourself from front to back after going to the toilet to avoid the spread of germs from the anus to the urethra. Remember, we said one of the bacteria which causes this infection is what we call E. coli, which actually lives harmlessly in the bowel, but it causes cystitis if it's spread to the urethra and during sexual intercourse. Another prevention measure is to drink plenty of fluids, that is plenty of clean water, and get to urinate frequently. Reason behind this, actually staying hydrated, it will be able to flush the bacteria to prevent some urinary tract infections like kidney stones. So if you hear of kidney stones, bear in mind that whoever has got this condition is not taking enough water. So it's good to hydrate your body. Women should drink cranberry juice to encourage acidity of urine. Why? When urine is acidic, it will interfere with bacterial growth. Most of the drugs in the market, especially which deal with urinary tract infections, you find that they have been incorporated with cranberry. Reason, this one will encourage the acidity of urine, which will interfere with the bacterial growth. Cystitis can be aggravated by coffee, tea, and alcohol. So those who take this should either encourage diluting them or they avoid them completely. Wearing cotton underwear, it allows air to reach your genital areas, and also you should avoid wearing tight pants. Point to note, women, buy good underwears, and especially the cotton. They have a cotton lining. Some people use pant liners. Why do you use pant liners? To absorb excess of this discharge, which makes somebody to be uncomfortable. Another point to note is to avoid using talcum powder, perfumed soaps, deodorants, all antiseptics in the genital area. And also, bath oils, douches, bubble baths, and shampoos contain irritating chemicals which will irritate your bladder and cause more harm. Another point to note is to urinate before and after sexual intercourse. This one can prevent the spread of bacteria. Another point to note is to empty your bladder as soon as possible. When you feel an urge to go and urinate, kindly go and urinate. Don't hold urine for long periods, because by emptying your bladder, if there are some bacteria, you are flushing those bacteria out. Another point to note is to practice safe sex. Medically, there is nothing which is hidden. It's black and white. Protect yourself from sexually transmitted infections by the use of condoms, and also limit the number of sexual partners. Be faithful to your partner only, but some people find themselves moving around from one person to the other. You have a number of sexual partners, and when you have this sexual activity, you don't protect yourself. So what are you doing to yourself? Sexually transmitted infections. There are many, you know them. Another thing is to do regular tests. Those people who are sexually active, do regular tests of sexually transmitted infections. You will be able to prevent yourself. You can get that you have an infection like chlamydia or gonorrhea. And this affects the urethra. When it comes to sexually transmitted infections, mostly it affects the part of the urethra. There are some lubricants which are used during sexual intercourse. This can prevent the bruising and swelling around the urethra that can lead to infections. So if we take good care of ourselves, we'll find that we have prevented these infections from occurring around 80%, because there are some causes which we cannot prevent, especially those which are caused by weak immune system, those who have what we call enlargement of the prostate in men, pregnancy, menopause. So we don't really have much to do with that. So it's good to take note of those. So if we prevent some of these, we will be in a better position to avoid these infections. Let's now look at what we call complications. Are there complications caused by this? Urethritis and cystitis. I said I'll mention these words interchangeably up to the last point, and I've come to the last part here where we are going to look at the complications. If they are not treated, both cystitis and urethritis can lead to serious complications. One of the complications is what we call pelvic inflammatory disease, PID. That is one of the potential complications of untreated urethritis. Urethritis, remember we said it affects the urethra. So if these conditions are not treated in women, will lead to infertility. And in men, will lead to what we call epididymitis, which is a painful condition that causes swelling in the testicles. When it comes to untreated cystitis, it can lead to what we call pyelonephritis, and that is the infection of the kidneys. That will cause permanent damage to your kidneys. And also, cystitis, if you are pregnant, that is women, and it's not treated, it will lead to what we call preterm labor and low birth weight babies. So, and again, in the case of cystitis, if not treated, it will lead to what we call sepsis. Sepsis is a life-threatening condition that occurs when your body's response to infections causes damage to its own tissues and organs. Urethritis, again, if not treated, can lead to what we call urethral strictures, that is blockage or blockages. Some people fail to pass urine. That is why they go and get, or they're put on catheters. So that is strictures actually is the narrowing of the urethra. So urine cannot pass through. The urethra is squeezed. Assuming if you have an enlarged prostate, sometimes it will squeeze the urethra, the tube, which this part, which gets urine, removes urine out from the bladder, the genitalia, all outside the body, it will get blocked. We can wrap this up because we have done a lot. Thank you so much. I believe you have gotten something. We are going to choose another urinary problem at random and talk more about that. For those ones who have just come across this channel, kindly consider to subscribe. Subscription is free. Thank you so much. Let's meet in the next video. Bye bye.